Mind Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional in your area.
You can contact us via Twitter at MindDeconstruct. I'm your host, George. With me is Dr. Kaz. Dr. Kaz Nelson is an American Board of Psychiatry and Neurology certified psychiatrist, licensed to practice medicine in the state of Minnesota, and an assistant professor in the Department of Psychiatry at the University of Minnesota Medical School. On today's episode, self-medication. This is episode 16 of the Mind Deconstructed. We have come a long way. Thank you everyone who's joining us on iTunes, Google Podcasts, Stitcher, anywhere else you get your podcasts. Some very exciting news in the Dr. Kaz universe. You were recently named Minnesota Psychiatric Society Psychiatrist of the Year. That's a bit of a mouthful.
It is, and a huge, tremendous honor given some of the amazing people who have been awarded this in previous years. So I'm incredibly touched and honored and shocked and really appreciative.
That's pretty exciting. Really kind of shows how well you're doing with this podcast, right?
I think my work in education and expanding this to education of the public and the general community is something that's been really exciting for me over the past year and may have had something to do with it.
Okay, so for our hot topic in mental health, again, the topic of today's episode is self-medication. This is the second anniversary of Prince's death. We are here in Minnesota, so we do get to hear a lot of news about Prince's death. So this was a horrible outcome associated with opioid use. The results of the investigation showed that he had taken some counterfeit Vicodin that contained fentanyl. I mean, if you watch the news about the opioid crisis, there is that risk of fentanyl, that super strong drug that sometimes people masquerade as a standard opioid type medication. And also the fact that people around him were concerned for the last couple of years, that kind of people around him knew about his opioid use, wanted him to seek help. He, in fact, knew that it was a problem and was going to actively be seeking help. All those things, it shows how much of a tragedy it was. And
how would the outcome now have been different if there had been earlier intervention or if this had never become a problem in the first place?
It's so tough because so many of those opioid addictions start with prescribed use.
Yes, with real pain and prescribed use, absolutely.
Coupled with the illicit underground market for opioids and counterfeit medications and Chinese fentanyl, it's just such a scary thing.
Yeah, there's a lot of availability of products and substances over the internet. Things can be delivered to your door in a brown package on the illegal market, and the accessibility and risks associated with this have never been higher.
So moving broadly to the entire concept of self-medication, why would someone choose to self-medicate?
Self-medicating is really understandable, right? If you have a headache, it's natural to want to take some Tylenol or some ibuprofen to help your headache go away. And so as we have this conversation about self-medicating, I just want to be clear that I'm not using that as if it's a ugly term or a bad term. It just simply is what it is. People experience something that's uncomfortable or painful or difficult to tolerate. And why wouldn't somebody access something that's going to bring them some relief for that?
To a certain extent, we can all fix or address some of our own problems physically.
Yeah, and many of us who wake up in the morning and start the day with a nice cup of coffee.
Or three.
So that is a form of self-medicating, though. There is a substance in there that interacts with the brain and the body, changes heart rate, impacts the nervous system, and it's something that's very routine for many people. So even that would be under this umbrella of self-medication for purposes of our conversation today.
So how far does it go? Like, if I'm hungry and I eat, am I self-medicating?
Well, when we think about the brain and all the different substances that interact with the brain, anything that you put into your body, including food, alcohol, marijuana, nicotine, caffeine, all of those could be considered substances that you put in your body in order to regulate your nervous system. And so legal or not legal, healthy or not healthy, there's a spectrum to all of these things.
So when is it okay to self-medicate?
That's an excellent question. And as with many of these types of things, it's probably going to be a little bit different for each person. But there is a line. Generally, when we think about this pattern of self-medication, we really need to take a step back and look at what is the function of the substance, or what is the function of the behavior. What emotion is trying to be reduced? What uncomfortable physical sensation? Is it pain, anxiety, sadness, disgust? Is it going to reduce a general sense of stress? Re-experiencing of painful memories? What is it that the substance is working to address?
Where's the line? Because obviously we're talking about this, if we're talking about it in the context of Prince or other people that we're going to say have an addiction based on their self-medication, where's the line?
Even in my example that I mentioned before about Tylenol or ibuprofen for a headache, there actually is, for people who have chronic daily headache who take Tylenol or ibuprofen, a point where those treatments actually contribute to the headache syndrome. And the treatment for that is actually to stop the Tylenol and ibuprofen and have a terrible, terrible headache, but it sort of gets the headache out of the system, so to speak, and gets the body back in balance. So we could all agree that maybe if you have a headache, it's not a big deal to take some ibuprofen as pain relief. But in some cases, it's the pattern and the nature of the symptoms where there's this dysfunction that develops, and what was meant to be helpful can actually be part of the problem.
So addressing food, when is your consumption of food going to be a problem? Could you be using food in a way that's self-medicating? And then how is that going to be a problem?
For anything, food, alcohol, marijuana, nicotine, caffeine, any of those substances that I described, there's general principles, and food is included. So if you're using any of these to actually change your mood state and to address something that's intolerable, then that's crossing the line over into problematic territory. So, for example, with alcohol, if you're out at a social event and have a glass of wine, they're serving red wine and you have one, and it's kind of part of that recreational activity, we would say maybe that's not a problem. But if it's 5 p.m. and you start to get irritable and, gosh, I need my drink, where's my wine? Then that's a problem.
What's the risk? I mean, obviously I'm aware of some of the risks, but generally or more specifically for some of these things, but like, what's the big deal? What's the problem with self-medication?
Well, with all of these things, they impact the brain and the body to induce changes in the brain's receptors, changes in the brain patterns, where typically you need more and more of it to have the same effect on the body. That's a principle called tolerance. So that's a problem if you're using alcohol and you have that glass of wine and it makes you relax and makes you feel better and really meets that emotional need for you. Pretty soon it's 2, pretty soon it's 3, pretty soon it's 4 to have the same effect. And that's because of the way the brain's receptors adjust over time. They get used to it. It doesn't mean that somebody is necessarily an addict or something like that. That's just everyone's brains, because it's a principle of the substance, not a characteristic of a certain individual.
So I used to do a caffeine reset where I would wean off of coffee for a period of time, get that kind of withdrawal issue out of the way, not have any caffeine for maybe a full week, and then start drinking coffee again. I mean, that was the plan. I was not planning on quitting coffee. It was just getting off of it for a period of time and then restarting so that my tolerance would potentially be lower. Like that one cup of coffee would feel good again versus needing 2 cups of coffee.
Yeah.
I mean, is that a valid theory?
That's pretty insightful, and you actually got pretty strategic about it. And you're doing this full well, knowing that after a period of time, that 1 cup of coffee is not going to have the same effect, and it's going to go to 2, and then it's going to go to 3, and you're going to do it all over again. And I'm not going to judge that or say you shouldn't do that, because if this pattern actually doesn't create problems for you, then by all means. But if you get up to that 3 cups a day and you start having a lot more stress or feeling like you're having trouble sleeping or that kind of thing, and then you go into that withdrawal phase and get real irritable for a week and tired and have trouble getting your work done, there may be some problems in there. where there's more consequences of engaging with this substance than there are benefits. But that's for you to judge.
It is more about the consequences or the problems. I mean, some of these substances have their own sort of health issues associated with them too, of course.
Right. And food and alcohol is maybe an unfair comparison because food is nutritious and your body needs food. Alcohol is not nutritious and your body doesn't need alcohol. So there's obviously a difference there. But when it gets into the function of interacting with this substance and the kinds of consequences that go along with it, when you're using it for the purpose of emotion regulation, that's when we would maybe want to look at alternatives. Because today we're talking about self-medication. So if you are using these substances to treat yourself of something that's a problem, the risk is that with certain patterns, you might actually have more problems down the line than the original problem you're trying to treat.
When do the medical professionals want to get involved?
Well, medical professionals are there to help for anybody who's noticing that they're having problems, who maybe wants to stop and find that they can't stop. And so with any of these, including smoking or nicotine, there's strategies and other supportive approaches to help transition. And often that involves replacing the substance with a healthier behavior or a healthier strategy. So for the example of alcohol, if somebody's using that to treat feelings of sadness or feelings of emptiness, we'll actually build skills and learn how to address that in healthier ways that regulate emotion that actually don't lead to these kinds of problems down the line that the substances do. And so when we can better understand the function of the substance, that will allow us to come up with a solution that will more appropriately or more completely address whatever it is that's leading to that behavior. And so we partner with any individual to try to figure out what could we do instead that perhaps would promote a more healthy approach to managing that uncomfortable or intolerable feeling rather than the use of the substance, which can have the risk of making that problem actually worse over time or causing other health consequences.
Would that be the same for food, perhaps? Some like overeating or...
Yeah, there are a lot of people who use food to manage feelings and emotions. And we talked about that a little bit before when we were talking about anxiety, for example. Ingesting food is a way of stimulating that vagal nerve, which connects the stomach to the brain. And so if people feel stress and are eating and using that as a way to stop the cortisol from coursing through their body, there's other ways we can do that that maybe don't lead to problematic overeating.
I mean, we've been talking about food and alcohol. I mean, alcohol, of course, is one of the biggies too for treatment, but the opioids or the methamphetamines or the cocaine-based substances, those are pretty hard to kick, aren't they? I mean, it takes more than just learning a few strategies and going to your primary care provider.
Those are extremely what we would call reinforcing substances, and opioids in particular not only have that tolerance that we talked about, but dependency, where if you've been taking them regularly and you stop it, you feel sick. I mean, like the worst flu you ever had in your life, sick. And so oftentimes working with a professional on approaches to minimize the withdrawal symptoms, manage that appropriately. There's also approaches in order to minimize the harm of those kinds of substances, transitioning to less powerful or substances in that same similar class with less abuse potential, or sometimes strategies that are pursued. And so that's a whole other conversation for another day. But today I'm more interested in talking about that fine line between helpful emotion regulation using substances and that unhelpful line.
Is treatment reserved for the hard substances?
I've interacted with a lot of people who are struggling with a lot of different symptoms, really having difficulty getting through the day. Maybe they're extremely exhausted in the morning related to depression or other factors. They'll have several cups of coffee, feel completely keyed up, using sleeping pills to fall asleep, and they get into this really problematic cycle.
Oh yeah, that sounds pretty dangerous.
Yeah, well, it's not very sustainable and it's not healthy. There are healthier ways to address the depression or the other underlying issues that are maybe causing some of those initial symptoms to begin with. And so we'll often work very closely with people in therapy, not just necessarily for a straightforward caffeine addiction, so to speak, but this interplay between self-medicating and its cost, because people end up then chasing some of these symptoms.
How do you feel about the kind of replacement factor? Like, yeah, we addressed your alcohol issue, but now you're smoking 3 packs a day and 10 cups of coffee. I mean, is that a better trade-off? I mean, are we okay with the trade-off?
Certainly, we do see that a lot, and it's generally better if somebody is self-medicating with a less harmful substance than a more harmful substance, but we'll still, in a non-judgmental way, want to address it and work with that person to meet their individual health goals.
And this is my question. I think I ask this question a lot, but how do you talk to a loved one that you see is kind of getting defensive about their use of whatever it may be, but hasn't really recognized how it's impacting their existence negatively?
That certainly happens all the time, and it's probably something we should be addressing on every show because of how stressful this is for somebody to see their loved one suffering with substance use or misuse or addictive behavior patterns. And what I recommend is that, to the extent possible, if you could approach your loved one non-judgmentally, saying that you care, that you're concerned, that you notice that they might be having problems and you're concerned about that, and that you're there for them to help if they would ever choose to want to get some support or help around that. And I think that non-judgmentalism can really go a long way in building trust in a relationship where they may reach out to you.
And it sounds like you're kind of building a conversation there. I mean, you might have to address it more than once, but remaining just kind of supportive but non-judgmental.
It's a way of kind of planting a seed and then watering it over time. But where people really tend to shut down is when you come across as judgmental or critical, or particularly in the case of people who are self-medicating, if there's a minimization of the problems that somebody might be having that's leading to them self-medicating, then that's a complete non-starter. So if you say, what's the big deal? You've got a good job and you've got great kids. Why are you drinking so much? Or, something like that. That's really going to be a non-starter to the conversation.
Okay. So what are we going to talk about in 2 weeks, Dr. Kaz? What do you think?
Next episode, I think we're going to do a bit of a primer on self-injury. Everything ranging from punching the wall in anger to people who maybe cut or injure their skin, all the way over to another set of behaviors where people pick or scratch or pull their hair out. And so there's a whole range of self-injury that we see, very different functions related to them, and be fun to understand some of those nuances a little bit.
Great. That sounds like a good episode. Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter @MindDeconstruct.